Hello students, today we'll be discussing on a topic that is medical termination of pregnancy. So medical termination of pregnancy is a critical component of reproductive health care that involves the use of medication to end a pregnancy. As nurses, understanding the protocol, ethical consideration and patient care aspects of MTP is essential for providing comprehensive and compassionate care. MTP typically involves the administration of medications such as mifepristone and misoprostol. How this works? The mifepristone works by blocking the hormone progesterone, which is necessary for pregnancy continuation, while misoprostol induces uterine contractions to expel the pregnancy tissue. This method is generally used within the first 10 weeks of gestation. As we all know, the nurses play a pivotal role in the MTP process, from patient education and counseling to monitoring for complications and providing a post-procedure care. The key responsibility includes patient education, providing clear information about the procedure, expected outcomes and potential side effects. The second one, emotional support, offering empathetic support and addressing the emotional and psychological needs of patients. The third one, clinical monitoring, assessing vital signs, managing pain, and monitoring for any signs of complications such as excessive bleeding or infection. And the fourth one, post procedure care, ensuring patient having access to follow up care and support service and educating them on signs that require a medical attention. Ethical and legal consideration, the nurses must navigate complex ethical and legal landscapes when involved in MTP. It's crucial to respect patients' autonomy and confidentiality, adhere to legal requirements, and provide a non judgmental care regardless of personal beliefs. Moving on to the first slide, legislation of abortion in India. Deliberate induction of abortion by a registered medical practitioner in interest of mother's health and life is protected under the MTP Act, that is Medical Termination of Pregnancy Act, keeping in mind the health of the mother and her life. There are certain provisions which has been laid down for this MTP Act. So we'll see one by one. The first one is the continuation of pregnancy would involve serious risk of life or grave injury to the physical and mental health of the pregnant women. Second one, there is a substantial risk of the child being born with serious physical and mental abnormalities so as to be handicapped in life. The third one, when the pregnancy is caused by rape, both in cases of major and minor girl and in mentally imbalanced women. The fourth one, the pregnancy caused as the result of failure of contraceptives. So these are certain provisions which are laid down for the MTP Act. In practice, the following are the indication for termination under the MTP Act. To save the life of the mother, that is therapeutic or medical termination. The indications are limited and scarcely justifiable nowadays except in the following cases. Pulmonary tuberculosis, when superimposed pregnancy deteriorates the condition. The second one, cardiac disease, that is grade 3 and 4 with a history of decompensation in the previous pregnancy or in between the pregnancies are justifiable indications for termination in the first trimester. The next one, the chronic glomerulonephritis, malignant hypertension, interactable hyperemesis gravidarum, cervical or breast malignancy, epilepsy or psychiatric illness with the advice of the psychiatrist. So these are the various listed down indications which you can see under the heading to save the life of the mother. So here we are keeping in mind the consideration. The first and the foremost thing which we have to do here is to save the mother of the to save the life of the mother irrespective of the parity. The second one is the social indication. This is almost the sole indication and it is covered under the provision to prevent a grave injury to the physical and mental health of the pregnant women. In about 80%, it is limited to Paris women having unplanned pregnancy with a low socioeconomic status. The pregnancy caused by rape or unwanted pregnancy caused due to the failure of any contraceptive device also fall in this category, that is nearly to 20% of the cases. So these are the various listed down things under the indication, that is social indications. Next indication is eugenic. Eugenics is a scientifically erroneous and immoral theory of racial improvement and planned breeding, which gained popularity during the early 20th century. Eugenicists worldwide believed that they could perfect human beings and eliminate so called social ills through genetics and hereditary. This is done under the provision of substantial risk of the child being born with serious physical and mental abnormalities so as to be handicapped in life. The indications is rare. That is, the chromosomal and enzymatic abnormalities of the fetus, which are identified as a factors responsible for the transmission of certain inherited disorder. Second one, when the fetus is likely to be deformed due to action of teratogenic drugs or radiation exposure in early pregnancy. Taking hormones either in the form of tablets or injections for diagnosis of pregnancy or accidental pelvic x-ray having less than 10 rad is not a justifiable indication, especially in first pregnancy, for termination. The third one, rubella, a viral infection affecting in the first trimester, is an indication for termination. The fourth one, history of one or both parents being mentally defective or previous children being malformed can be a reason for termination in consultation with a genetics. Moving on to the small note of unsafe abortion. The termination of unwanted pregnancy either by persons lacking the necessary skills or in an environment lacking the minimal standards for both. So this conditions can lead to a unsafe abortion. 90% of the unsafe abortion are in the developing countries, comprising 13% of maternal death. Almost all the complications are preventable if it is performed in a safe manner with proper post-abortion care services. So we have come to the end of this small topic, that is MTP, medical termination of pregnancy. In conclusion, medical termination of pregnancy is a safe and effective option for terminating an early pregnancy. As frontline healthcare providers, nurses are integral in ensuring that patients receive high quality care throughout the MTP process. By staying informed about the clinical practices, maintaining compassionate patient interaction, and upholding ethical standards, nurses can significantly contribute to positive health outcomes and patient well being. I hope this class was informative for you. If you have any question, kindly put it in the comment section. Thank you.